Welcome to Hands-On Therapy's home exercise program. This video will explain wrist flexion and extension, which are exercises 13 and 14 on your handout. Regardless of whether you perform this exercise with an open palm or a loose fist, this exercise is designed to help you increase your wrist flexion, which is bending it forward, and extension, which is bending it backwards. It also helps to increase your daily functioning. To name a few, some functional tasks that require wrist flexion and extension with an open hand include washing your back in the shower and pushing yourself up from the ground. This exercise will also help with functional grasp and release of different items. Wrist flexion and extension with a loose fist is also used in many functional tasks, such as using a screwdriver, brushing your hair or teeth, and even using utensils to cut and eat food. The muscles that extend or bring back your fingers can also extend or bring back your wrists too. Performing wrist extension with a loose fist, as in exercise 14, prevents your finger muscles from pulling back your wrist. This means that it isolates your wrist extensor muscles to perform this movement. Now that you know the purpose and importance of this exercise, let me show you how to do it. First, I'll show you wrist flexion and extension with an open hand, which is exercise 13. Rest your elbow on a table that is around mid-chest level. Open your hand so that your fingers are straight but relaxed. While keeping your forearm still, bend your wrist back as far as you can. When you feel a stretch, hold this position for 5 seconds. Then slowly bend your wrist forward until you feel a stretch and hold for 5 seconds again. If you're having difficulty keeping your forearm still, you can use the other hand to support it in place. Try to keep your fingers as straight as possible throughout this exercise. Now let's look at exercise 14, which is wrist flexion and extension with a loose fist. Rest your elbow on a table that is around mid-chest level. Close your hands so that your fingers are in a loose fist. While keeping your forearm still, bend your wrist back as far as you can. When you feel a stretch, hold this position for 5 seconds. Then slowly bend your wrist forward until you feel a stretch and hold this position for 5 seconds as well. If you're having difficulty keeping your forearm still, you can use your other hand to support it in place. Sometimes holding an object such as a pen or a highlighter in your fingertips helps you to keep your fingers flexed or closed. Your therapist may instruct you to do a combination of these two exercises, which includes doing wrist flexion with an open hand and wrist extension with a closed fist. This is what it looks like. Let's do 10 repetitions together. As always, ask your therapist if you have any questions when completing this exercise. Thanks for watching.